I sought Botox to help the heavy eyelids, the heavy forehead, the wrinkling that is absolutely genetic within my family, plus sun damage.
I've always considered my forehead to be an active forehead. No one else would probably notice that but myself. So the last 5 or 6 years, I've noticed I had more fine lines.
I wanted to explore the option of Botox when I approached my mid-30s. I began noticing lines in my forehead and around my eyes. All the stress and hard work is starting to show on your face, and Botox made me feel more comfortable in social settings, more confident at work.
Botox now has competition from another company called Medicis, which makes another substance called Dysport. I find that the Botox is probably more effective than the Dysport when used in the glabellar area for the vertical lines here, although my experience has been that the Dysport is actually a little bit more effective than the Botox here, and so I frequently find myself mixing and matching.
Seeing Dr. Friedman, the detail that he put into where the injections would be and how much exactly I needed. I still wanted to maintain a natural appearance. For me personally, it was exactly what I wanted to achieve, and my husband definitely noticed a difference. My girlfriends, that they could tell I'd done something.
After I came to Dr. Friedman, I saw a huge difference in the way Dr. Friedman did it as opposed to where I'd gotten it done at other places. My eyes were more lifted, I looked more natural. He just did such a good job hitting the areas that needed to be done, and I was more bright, and people say, "Oh, are you having a good day? You look so happy today."
I personally perform every Botox and Dysport injection. There are cookie-cutter patterns for how to do this, which are provided by the medical manufacturers. However, I don't think those patterns necessarily apply to all patients, and I think it's important to individualize the injections according to what people are looking for. Do you want to be completely frozen? Do you want to simply be weakened? Do you want your brow higher, lower, shaped differently? What are you after?
It's like he's a perfectionist. He marks the areas, which I'm told a lot of doctors don't do. They just start injecting.
When it's your face that you want the customized approach, the detail that he put into customizing my particular face made a huge difference from where I'd previously been going.
I think it's also important that people have a comfortable experience.
Here at Dr. Friedman's office, it was such a different experience than I had experienced at other places getting Botox. He made sure that before the injections were done, there was a numbing gel applied. During the injections, I was given the option of laughing gas, and then after the injections were done, cold compresses, ice packs were applied, which helped with the swelling.
I prefer to use the gas during the procedure, and then he will ice pack down after.
He is an artist, and it shows with his work, and that was what set him apart from other surgeons that I had gone to in the past for consultations.
I would definitely recommend Dr. Friedman. He's kind, caring, he's a perfectionist, he's an artist.
Botox is probably the most popular injectable ever invented. It is used hundreds of thousands of times a year. It has an excellent track record with regard to safety, and it works extremely well.